Let's redefine motherhood. The term geriatric pregnancy is outdated and unhelpful. Women in their mid-30s and beyond are vibrant, strong, and making empowered choices to become mothers. Motherhood today is about conscious timing, building careers, finding the right partner, and pursuing personal goals before starting a family. This isn't a delay, it's a thoughtful sequence. If you've been labeled with that old term, let it go. We're replacing fear with facts, empowerment, and celebration. You are part of a growing group of women raising children with maturity, stability, and perspective. Forget the scary labels. Your age is part of your powerful story, not a barrier. Let's start this journey from a place of strength. If we're tossing out geriatric, what's next? The medical term is advanced maternal age, or AMA. AMA means being 35 or older at delivery, a marker for increased monitoring, not a judgment. It's not a cliff, it's a gradual shift, prompting more personalized care. You'll get more ultrasounds, screenings, and genetic testing options, tools to support you, not limit you. Today, more women are having healthy babies in their late 30s and 40s than ever before. AMA is a tool for your doctor, not your identity. It opens doors to better care and more information. When you hear AMA, think more support, not more risk. Let's talk honestly about risks because knowledge is power. Yes, risks like gestational diabetes, high blood pressure, and chromosomal abnormalities increase with age. But higher risk doesn't mean guaranteed problems. For example, at 40, the chance of having a baby with Down syndrome is about 1 in 100. Most moms 35 and older have healthy babies and normal pregnancies. The risks for you and your baby are a little higher than average, but still very low. Some of those risks include birth defects. Older women are more likely to have a baby with a chromosome disorder such as Down syndrome. If you are age 25, the chance of Down syndrome is about 1 in 1,250. If you are age 35, the risk increases to 1 in 400. By age 45, it is 1 in 30. Most miscarriages happen in the first 13 weeks of pregnancy. With age, your risk of early miscarriage goes up. At age 35, the chance is about 20%. By age 45, your chance is 80%. High blood pressure and diabetes. You may be more likely to develop high blood pressure or diabetes during pregnancy. These conditions can cause problems including miscarriage, growth problems in your baby, or complications during birth. Placenta problems. Placenta previa happens when the placenta covers all or part of your cervix. This can lead to risky bleeding during delivery. If you're in your 40s, you're 3 times more likely to have placenta problems than a woman in their 20s. Even so, the problem is rare. Premature birth and low birth weight. Older women are more likely to deliver their babies prematurely, before 37 weeks. As a result, older moms are at risk of having babies weighing less than 5.5 pounds at birth. Still, a 99% chance of not. With modern prenatal care, most risks are manageable. Regular checkups, healthy habits, and a strong partnership with your provider make a huge difference. Today's women are often healthier, more informed, and more prepared than ever. Your maturity and life experience are assets. Approach pregnancy with discipline, focus, and optimism. Let's talk about the advantages of becoming a mother later in life. Emotional readiness, knowing yourself and your values, brings calm to parenting. Financial stability means less stress and more choices for your family. Older mothers tend to be more patient and create supportive environments. Life experience helps you focus on what truly matters. Pregnancies at this stage are often deeply intentional, bringing gratitude and presence. You savor the moments, building a loving, stable home. Your wisdom is a gift to your child every day. Doctors focus on medical metrics, but you have enormous power over your pregnancy. Nutrition, fitness, and stress management are your best tools. A balanced diet and moderate exercise, like walking or prenatal yoga, Help manage risks and prepare your body. Ask for guidance if you need it. Building strength is proactive care. Advances in prenatal genetic testing offer reassurance and information, not just difficult decisions. Your mindset matters. Empowerment leads to better questions and advocacy. Seek support, celebrate milestones, and prioritize your emotional well-being. You're not a passive passenger, you're the pilot. Your choices shape your pregnancy. Mental and emotional strength are vital resources. Use them. Remember, you are not a statistic. Risk categories are guides, not prophecies. Millions of women over 35 have healthy babies and fulfilling motherhood journeys. You're redefining what motherhood looks like today. Be proud of your wisdom and the life you've built. Build your village. Find supportive providers and connect with other mothers. Be your own advocate. Read, research, and ask questions. Be kind to yourself. Nourish, move, and rest your body. Share your story and light the way for others. Motherhood has no age limit. Trust yourself. A beautiful chapter is just beginning.